Hello. Welcome to this episode of a Creative Approach podcast. I'm your host, Karen Poirier-Brody. I know you will enjoy the story of today's guest, Dr. Carolyn Giroux. Dr. Giroux is a very creative physician who writes professionally and personally and shares some of her poetry and essays in Sierra Sacramento Valley Medicine, the official journal of the Sierra Sacramento Valley Medical Society. This lifestyle journal promotes the history, art, and science of medicine, the protection of public health, and the well-being of patients and their caregivers. I have the delight of serving on the editorial committee with her. Here at the homestead, it's been a family week. 4 of the 7 sons have visited this week, as well as spouses and grandchildren. One of our boys had an accident mountain biking and will be having surgery for a broken bone. So while he's not with us in person, our thoughts are with him and his family for his quick recovery. Our first community is our family, but I find valuable other social connections with old friends, my women physician colleagues, and my podcast community. It's great to have heard from so many this week. All that on top of the connections on social media, which I always say are the best parts of that technology. Weaving a sense of community is so important. My husband is from Kentucky, as I've mentioned before, and horse races are significant around here. I know many people consider racing cruel both to the beautiful beasts and their jockeys. And while that may not be true for the elite of the sport, I agree it is likely an unfortunate reality elsewhere in the racing world. We steer away from regulation in today's political environment. I hope that good practices can be monitored and enforced in the racing world. A magnificent horse like Justify, who won the Triple Crown, is an excellent animal who loves to run and whose heart even brings his jockey to near tears. This horse did not race as a 2-year-old and is getting a rest before racing again, which is as it should be. I think this exceptional Triple Crown winner has a lesson for us. We may not be great talents like Justify, or the very human award winners of the Tonys that I just watched, but I wish for all of us to have that sense of passion for being our authentic selves and following our hearts with enthusiasm. I encourage you, my listener, to incorporate a creative approach to living and willingness to be your unique self with hope and willingness to transform. Listen now as Dr. Carolyn Giroux and I discuss creative lives, the human condition, and her wisdom and advice for healing and transformation. Welcome to a Creative Approach podcast. Today, my guest is Carolyn Giroux, who is a psychiatrist and a writer and author, and that's how I know Carolyn. We both serve on the editorial board for our local medical society magazine, and I asked Carolyn to speak not just because she's a very creative person and writer and very puts her thoughts well into words, probably way better than I can, but that she has some expertise on an issue that is important right now and is in the news, and that has to do with suicide and depression. So I think it's still going to be very upbeat kind of talk, but I'm hoping that we can address some of that as we go along today. So welcome.
Thank you so much, Karen.
And I guess, since I've given a very rough introduction of you, maybe you want to tell us a little bit about what it is that you do.
Yes, well, I'm a psychiatrist, which means that I'm a doctor, but I specialize in psychiatry. So what I do is I assess people who consult with me and try to determine if there's any major mental disorder that we need to do something about. And then I do recommendations and I help them finding a balance in their life. And I also offer psychotherapy. And I work at UC Davis, so that means I'm also an educator. I'm really involved in teaching. And this is a very stimulating environment. So my work is clinical, but also highly educational.
Great. And You obviously have a little bit of an accent.
Correct.
So, like me, you're not originally from Sacramento, California. I was
Giroux
wondering.
and Poirier sound really French, right?
Yes, I think so. They do. And I think we've traced back, we may have some kind of relationship that goes back maybe at least 8 generations.
That's what you mentioned the other day.
Yeah.
I will be really
But it may just be my
curious.
marriage, because that ancestor may have had two wives. One may have died and then married again. So we may come from 2 different branches of a family. But anyways, it's an interesting thing because one of my hobbies is genealogy.
Nice.
So anyways, to get back to that, maybe how is it that you came to be a psychiatrist, and what about this writing? Because I know you write other things besides articles for the magazine.
Yes, psychiatry has been something that's been fascinating for me since I would say the end of high school. And at that time, I knew I wanted to go to medicine, but I wasn't sure about the specialty. So I basically, as an introvert, became very interested in the human condition and human suffering. And I thought psychiatry was a good field to also kind of express my creativity, because a lot of psychiatrists were also writers and or philosophers or artists. And this is something that really spoke to me. And I felt like I could find in psychiatry the intersection of various passions I've had. So that's about it. It's probably more complicated than that, of course, because we encounter people who have suffered mental illness and we might have had some deep sorrows. It's so universal that I felt like, okay, well, I want to do something about that, and I want I want to give hope to people, basically.
We're the ambition, and, I think sometimes a lot of our ideas of where we're going to head in our future come to us from experiences we have as children, and that, we come to our realization that maybe we can accomplish things in our late teens when we're finishing up school, our basic education, because we're supposed to get a job, but just where do we find ourselves to fit in?
Yes, and actually my parents maybe, I guess, inspired me in a way. My dad was an attorney, my mother was a school teacher, so they were really working with people, and this is what I wanted to do too. That was another reason why I chose medicine. And my mother actually worked with children with disabilities, or I would say even adults with disabilities, and I would help her sometimes in her classroom. And this was very eye-opening for me to see her helping others and finding gratification in that. So that probably inspired me, and that probably played a role also in my choice of career.
Yeah. Now, were there any other doctors in your family?
None.
None, yeah. Me neither.
Interesting. So you were a spontaneous mutation, I guess, like me.
Yeah, the 2 of us, yeah.
Yeah, one of my aunts was a nurse,
Uh-huh.
and nobody else was in the medical profession.
Right. Funny how we find that to be our path, but I can see you being the direction. Of course, your parents valued education, highly valued education. So I'm sure
Yes.
that you knew you were going to be heading off to college at some point.
Yes, they
Although, isn't that true of most kids in Canada?
what
That
exactly?
they head off to college.
Yeah, because Cégep is like the college right after high school, but it's kind of I would say not a 2-year waste of time, but it's a transition before university. So I think it's less brutal than what happens here in the school system. Teenagers after high school, they go to a different state away from their parents, and then they start basically their professional path, or they're supposed to know what they want to do in life, versus in Quebec we have a little bit more time. So that was not as big of a shock for me, actually.
Yeah, I thought that was interesting because I think, of course, in Western Canada, it's different. It's more like the U.S., but
Yes.
Ontario has a grade 13 and Quebec has the CEGEP system. And
Yes.
those are those interesting transitions. And they're a little different than community college, too, because you're going to go on to actual official university. Although,
Yes.
in a way, they're a little bit like community college, but not quite the same. So you're right. I think it is it's more accepted transitional path than might be
Yes.
here. And that's the hard part, too. Like in Western Canada, you'd end up even after grade 12 there, you end up in second-year university if you come to the United States, usually, I think. So maybe there's more demands there. I don't know why.
Yes, it seems like a lot of pressure at such a young age.
I think it is a lot of pressure for young people. And I think a lot of pressure here. And it's a big deal in going to college. But of course, the percentage of people who go to college in Canada is much higher than it is in the United States, I believe.
I don't know. I didn't know.
Yeah, I have to check those statistics. Maybe I can get back to you folks
Yes.
on that one in the show notes. But my understanding is that there is a higher percentage. Now, so no one in your family had gone into medicine, and did you go into a pre-med program in college, or were you pretty much decided by then that was your path?
So I studied health sciences in Cégep, what we call college in Quebec, and I was not accepted to medical school right away. It was actually a record year, like we say, une année record, in the sense that there were so many applications that year, and I had good grades, but that was obviously not at the top. So I went a different route, and I went to physical therapy. So I had my bachelor's degree. And after that, I applied because I knew that with a bachelor's degree, my chances would be higher to be admitted to medical school, with maturity and experience and, good grades. So I worked hard and it worked. And actually, that meant that I didn't have to do the pre-med year, and I went into a 4-year program because I had, physical therapy is kind of similar, or it's in
right. Well, but you're doing a lot of anatomy and
correct.
Physiology and things in physical therapy, and it's very interesting to have that kind of background and then go into psychiatry.
Yes, and I thought that it would not really help me at all, but I'm so glad I've done that because I feel like there's so much in medicine that's been split, and now we're reintegrating body and mind, and it makes so much sense. Like now I can explain to my patients, why do they have fibromyalgia? Why do they have chronic inflammation? And what can they do about that? And I can understand why yoga works. And now I practice yoga. So I feel like, wow, that was actually a blessing to have that detour. Yeah.
Of course. Yes. Well, that's wonderful. But yes, it's a great way to have that experience to bring that integration. And that is important, the whole person, I think, when you're looking even at the issues of mental health. Now, and then as far as writing, was there anybody, your mother was a teacher, so maybe there was something there, but were there people who inspired you as far as writing?
That's a good question. I also wondered where I got that. Actually, my mom liked to write mostly speeches when there were some events at her school and there was somebody who was retiring or somebody to recognize, but that was it. And she, of course, wrote nice cards to us and nice wishes. But I think there was somebody who actually was very influential in the family, and he was a priest, and he was a writer, and he was a poet. And he was my mom's uncle, and his name was Origène Grenier, and he actually published a book, or somebody helped him publish a book, but he was a very impressive person, very tall, and we remember how strong his hugs were, and we were kind of like feeling compressed whenever he would hug us, the grandchildren. But that's the image of him that I have. But he was also somebody who was really good, and he was very poetic, obviously. So, but I guess he was kind of mythical in our family. And I probably remember that and associated the writing with something very idyllic. And I probably romanticized it partly because of him. But he was one who really obviously was good with words. And I also have some aunts who like to write. Actually, I have, my mom's sister is a painter, and she sometimes writes some poetry. So maybe there's something, maybe there's more than I think if I start digging. And I think everybody can write, can be poetic. It's just like some people don't express it. And I think that's what happened in my family. Most people just didn't exploit that.
Right. And I mean, not everybody's going to be a great poet, but I think, that it's a lovely way to tap into one's emotions is to use poetry, because you don't have to come up with the plot and the story and the I love storytelling, but I kind of do it with pictures and things. I do my scrapbooking, as you can see.
That's
Carolyn's
wonderful.
in my home and sees my massive scrapbooks in front of us here that I've created to tell my family stories and personal stories. But there's a lot of different, I write too, and of course do the podcast. I love to talk to people about their stories. So I explore that in different ways. But I think poetry is something that moves me a lot. And there have been some wonderful poets. I mean, one was on Whitney Greenaway was on PBS recently with a incredible poem on their brief but spectacular moments. And I, like so many others, just cried when the poem was done. So I think it can really speak to us in many ways. And sometimes we can use poetry to help us with some of our journey. Now, in your work, I think one of the things that I mentioned was recently we've had, you and I, we talk about our creativity. People who are guests on the show are creative people who explore many different areas. And recently we had two incredibly creative people, Kate Spade and
Anthony Bourdain.
And both of them committed suicide, and we know they both had problems with depression, but of course people say we didn't see this coming. And I don't know, obviously the statistics are, and you probably have some of those, that suicide rates are increasing in this country, and I don't know, is depression increasing in the country? Do you have some thoughts about this problem, and are creative people more susceptible to emotional problems than other people? I have a feeling it's just pretty darn common in general.
These are great questions. And yes, suicide rate is unfortunately on the rise in this country. Over the last 17, 18 years, it's increased by 30% and even 50% in certain states. So it's very alarming. It's a tragedy. It affects people who struggle with mental illness, who end up committing suicide, but also their families and their surroundings. In terms of are creative people more vulnerable to that or more at risk, it's a question that I find really hard to answer, because I think there are various confounders. These creative people were highly successful. They're also very famous, and that might be part of the problem. I'm wondering if there is difficulty reconciling the image people have of them and the image they have of themselves. Because they're also ordinary people, just like you and me, right? They're human beings, but they're put on this pedestal, and they might feel like they have to live up to the public's expectations.
Yeah.
And that must be quite a burden. That must be overwhelming. So there's that. There's also, I guess, the lifestyle. People having contracts, being in demand all the time, not having a life. Like Anthony Bourdain, I think at some point felt really down because he could not see his wife and his daughter for most of the year. He was no longer connected as we human beings need to be. And that might have taken a toll on him. There's also addictions, because in order to keep up the good work and be productive, a lot of people use substances. Or in order to cope with the lows that are part of human existence, they might, again, use mind-altering substances. So I think there are a lot of factors involved. There might also be a copycat syndrome or a phenomenon. You know, we hear about suicides, it's more available on social media and media in general. But that might also, unfortunately, influence people who are at a vulnerable time in their lives.
Yeah. And, suicide is a very charged issue. And, of course, there are, the medically assisted suicides. But those are people who are usually in a very, certain death is coming and they're in considerable pain. And they are people who die, often supported with people around them, which is a totally different experience. There's something so terribly alone and so terribly alienating, and that in the typical suicide, it's just so sad because, so suicide isn't even just one thing. People deciding to end their life because the pain is insurmountable and they're going to actually die in the near future, but die with family support and people around them in a loving environment is a totally different experience than people who must feel so alienated and alone, and they leave behind a tremendous amount of pain for everyone around them.
Yes, I think you mentioned a core theme, which is alienation, and they're also probably alienated from themselves at that time. I think the suicidal crisis could be conceptualized as an inability to transform a difficult experience, or thinking that the desire to die means actually that one should be dead. But in fact, what it means is that person is ready to change or transform. And that's a missed opportunity when the person decides to take his or her life. Because if you seek help at that time, then you are forced to look at your vulnerabilities, at your shame, your fear, your hopelessness. These are not really pleasant territories to go to.
No.
But they're essential to heal and to be empowered. So that's what I've learned from my clinical experience. That's what I observe in my patients. And of course, everybody is different. There are other stories of suicide that might involve something else. It can just mean that the person has not disclosed very important information. Like, I'm thinking about Robin Williams. It came as a shock to me at the time, a little bit like what happened this past week. I really admired his talent, and I thought, wow, he's the man, or the king of laughter, and how could it be? But afterwards, we found out that he actually had a very severe illness, and probably didn't see that there was any hope for him. So I'm wondering, in other cases of suicide, there might be so much that we don't know about the person, about the person's possibilities, or also the problems. There are socioeconomic problems, health problems, interpersonal problems, and maybe they reached a threshold that was too overwhelming. And again, they reached this state of hopelessness.
Right. And it's really sad because if people are really locked into that point, sometimes they don't seek the help that's there. And yet we know from people who have been rescued from suicides, because I was thinking this kind of ties into some of our gun violence concerns, in that we know that people who try other methods of suicide other than guns are not always quite as successful. And those people who are rescued usually express gratitude that they were rescued, whereas guns are just so totally fatal, and that there isn't that opportunity. And it's really sad because people just are so desperate sometimes, and yet if they could only find themselves able to ask for help.
Yes, and you're right. I think we have a lot to learn from people who attempt suicide and do not complete suicide. We have a lot to learn from the process that helped them reconnect with their own essence and with life in general. I think we have a lot of exploration to do. And also, looking at our policies and the gun control, I think guns are a problem. Actually, 50% of suicide here in this country are due to gun
violence.
Gun violence, exactly.
Right. So, and it's older, men over 50,
yes.
White men over 50 who are the victims of gun violence, self-directed, but
think about, for instance, a divorced white man over 50 who just lost his job, who got, whose wife walked away, and who's an alcoholic, and who actually also owns a gun. Then you have an explosive mix of risk factors. Yes. So that's a ticking bomb. And we have to know these risk factors, because if the person reach a point or a threshold, like I mentioned, of stressors that overwhelm the person's coping mechanisms, then there's a high risk of acting out.
Yeah, that is a big concern, and that makes people just that much harder to reach. But obviously these suicides were not gun directed. They were, people who hung themselves. And
yes, and I've wondered about that too. Actually, Robin Williams also hung himself, and I believe Kate Spade had been quite fascinated by the circumstances of his death, based on what I read recently. And I'm wondering, symbolically, what does that mean to hang yourself? Suffocating. I think we also need to look at that, because another reflection I had on suicide is that a reenactment? Is that a form of reenactment of a traumatic experience or difficult experience that didn't have a resolution earlier in life? Or does it have a symbolic meaning? You elevate yourself, basically, when you hang yourself, So does that mean, like, okay, the person really needed to transcend something difficult, because transcendence is actually something that's going to help people cope. But they've done that literally, not metaphorically.
Interesting.
So I really think that people should actually talk more about this, because once it happens, we're shocked, we're sometimes traumatized if it's somebody close to us who died, and then we want to move on. We don't want to think about it. But no, I think we should actually pause and try to deepen our understanding of what have led those people to do that.
Right, and hope to avoid it with others in the future.
Correct.
And depression is, if people would help themselves, bring themselves to get some treatment, in most cases is quite treatable.
Yes. We have effective therapies. Depression is actually very common. 12 to 25% might experience depression. There's a difference between male and females, but I believe it's because male might express depressive feelings differently than women, and women seek more help. So I think our data might be a little bit biased or not representative of the reality. So depression is actually treatable with psychotherapy, medication, and lifestyle hygiene. These three together increase the recovery rate. I don't think meds alone can work, but I think some kind of psychotherapeutic exploration will help the person expand the coping skills and deal with stressors later in life more efficiently, and also grow from that experience. Because a lot of people feel like, okay, they are depressed, they feel like a failure. But again, I see that as a transformation phase, like a fallow phase. Is that what you say in English? Like in French, we say jachère, when you leave in agriculture.
Leave the field fallow. Yeah.
Exactly, yes. So
Yeah.
I see that maybe that's a way for the person to just replenish resources.
Right.
It's like a sabbatical of the soul. Maybe.
And that we may need that you need some respite sometimes, because things, and especially in this culture, things drive people a lot. I mean, I suppose you said using substances like alcohol and of course heroin, talking about another topical subject, which is just really sad, but I think people are perhaps feeling too overwhelmed.
Yes, again, the opioid epidemic is another problem, and it could also contribute to the increase of suicide rate in this country. And
accidental as well as intentional.
Yes, and again, when we see people who died by overdose, we're not always sure if it's accidental versus suicide. So the suicide rate can even be underestimated.
Right.
But yeah, I think a lot of people try to numb difficult emotions with substances. And I see that in my patients who have suffered trauma. And not just in patients, but also people I know who are trying to numb their feelings associated with traumatic reactivation or flashbacks or unpleasant feelings. But it creates problems.
It has its own set of new problems that
Correct.
Not exactly great. And of course, we don't have a very understanding society when it comes to substances, despite the prevalence of use. I mean, people use alcohol and then we condemn them if they use it to excess. People use these other substances. They obviously work to some extent, at least in the early stages of a problem, but they have such terrible consequences.
Yes.
And then they're also associated, talking about that, adding shame to everything, because we tend to condemn these people instead of understanding.
Yes,
that life
creates
is
a vicious
difficult.
cycle.
Yeah, it is a vicious cycle. Well, but there is hope, as you said, that it's very treatable to treat depression.
Yes.
That substance abuse, there are many specialists available. Unfortunately, I know some people don't always have insurance resources, but there are free clinics, and hopefully in places where people are, they can seek some kind of help.
Yes.
And counselors and many religious practices, I think many of the pastors, priests, and other leaders in the religious community are getting trained and learning to be able to help and counsel people.
Yes, and in fact, being part of a group where there's a religion or there are some rituals has been shown to protect people against depression or even suicide because of that sense of community, but also maybe because of the mindfulness that certain rituals induce. So it's not necessarily the religious affiliation itself that will make a difference, but it's the mechanism underlying this. So I think I would encourage people to reach out. They don't have to have a religion, but having a community, having somebody you trust or somebody you can confide in, and there are groups in the community, and there are also sliding scale counselors. So there are resources, and I encourage also all the professionals to be very curious about the patient or person coming to them and with problems, whether it's addiction or suicidal crisis, and ask them what happened to you, instead of why are you this way or what's wrong with you, It's like, what happened?
What happened?
Because people do these things for a reason.
Right.
There's no such thing as symptoms in a vacuum, very rarely. I mean, I always see a context, some kind of stressor that leads to the emergence of symptoms in my field.
Right. And then you were talking about the importance of ritual. I think we can establish a certain kind of ritual. I mean, there's something about a pattern to our day that can be very comforting. I know I listened to some lectures and have read some work by Jean Shinoda Bolen, and she talked, the goddesses in every woman and the importance of Hestia, who's the goddess of the hearth and the goddess of the ritual and, the simple things of washing the dishes, sweeping the floor. Doing those things can be, if it's done in a pattern, it can be very comforting.
That's wonderful, because I was thinking about something similar over the weekend. I was putting my clothes on a clothesline to dry, and this is a habit that I've imported from Quebec because I don't see anybody else in my community doing that. But I find a lot of satisfaction
very ecologically sustainable.
Exactly.
There actually are some rules against doing that in some parts of communities. They don't want to see people's laundry out there, which is, I'm hoping that's changing, but there actually, some people do have rules against that.
I know.
It seems silly nowadays when we're talking about sustainability. But anyways, get back into what you were talking about, putting the clothes out.
Yes, like you've mentioned, the rituals or the daily activities that we do that seem repetitive or a little bit boring are actually very important, I think, to our mental balance. And maybe celebrities don't even do that anymore because they have a bunch of people working for them or assisting them, and they don't have to bother with that. But again, I think it takes away an opportunity for mindfulness, because when we fold the laundry, when we cook ourselves, or even clean the bathrooms, we have to be mindful if we want to have some joy in doing that. At least feel neutral about that. So doing things mindfully really is going to help with the mental and physical balance. And that's what these things allow me to do, even if I don't always like to do them.
Right.
So it's important to make room for that. Make room for that. When you're in the shower, try to do that mindfully, like feel the soap on your skin or the shampoo in your hair, brushing your hair. I like to braid my hair sometimes because it's a way for me to be mindful. I have to be very careful.
Right. Braiding, yes, requires a little intricacy of making sure you pass the right, then the left.
Exactly.
Get that braid just right.
Yes.
Or else you got to start again.
Yes, if I'm not attentive. So that's what mindfulness is about, is knowing what's happening as it's happening and paying total attention to everything around you, if possible.
Yeah, that is. Obviously, I'm in the process of cleaning my house, and I talked about that as an intro to a couple shows of getting organized, but there is a certain satisfaction in that, and you're right, you have to just kind of deliberately go through things step by step and think things through, and it can be very helpful. Well, I think these are all great suggestions, and I think we'll mention it now, and then maybe we can mention it here again, but the phone number for the suicide prevention.
I want to mention that because that 45,000 Americans die by suicide every year. That's 123 per day, including 3 college students. So for you or who is in distress or who if you know somebody who has a crisis, please call the National Suicide Prevention Line at 1-800-273-TALK or 8255. Again, I repeat the number. It's a 1-800 number, 273-TALK, 8255.
Yeah, I think as a resource, that's very helpful. And then, of course, many of the other things that Carol and I have been talking about. Now, in the whole idea of mood disorders, I think you've written some things on this subject. And
yes, I am teaching, as I mentioned earlier, and I put together a module for the medical students at UC Davis, I believe 5 years ago, and I updated it last fall. And I also teach the medical students every 2 months on that topic, and I talk about these things like suicide and also life hygiene and also the wounded healer, because in the medical field, we are at risk of suicide, so it's important to be aware of that. So
yeah, it's sad that us who can help people in healing are also so vulnerable sometimes to the stresses, because it's a stressful job.
It is, and I think it's part of the reason why a lot of doctors are burnt out, but I think it's really important to try to advocate for ourselves and maybe change the culture, while at the same time making sure we make room for self-care, and without making that a to-do item, to-do list item.
Like, yeah, the last thing somebody needs is to add pressure of taking care of themselves. But that is important. I mean, there are parts of the profession that are, it's all of it is mentally and emotionally stressful, and some, like orthopedic surgery and OBGYN, can be very physically demanding,
yes,
as I know. So, there can be all kinds of pressures that come to bear on people, not to mention lack of sleep and all the rest of the things that we know are, as part of, you were talking about life hygiene. I think, yes, the importance of getting a good night's sleep. And if you aren't, go see your doctor, please.
Yes, and try to remove the obstacles for your sleep rather than getting a pill, because that's going to create another problem, right? So
right.
It's always better to try to look at what's in the way of a healthy life before getting to the last resort medication. But I encourage people to reestablish those biorhythms and making sure that, there is this sleep hygiene, the healthy diet, exercise, and mindfulness, yoga, and also socialization. So that's one of the very important elements for mental health and also to prevent suicide is socialization. And it's important of staying connected to a network and to people that you can identify with or that give you a sense of belonging.
Right. And, we all have our own communities. And certainly if you are a creative person and an artist, there are so many people who have found creative outlets, and there's so many ways you can connect even through the internet these days, and meetups and whatever. Sometimes I think I was going to say that I think it was a lot easier to be isolated before. Now you really could, if you just a little effort, to make connections.
Yes.
It's not that hard anymore.
You're right. Some people who are not really comfortable in social settings can at least reach out with social media or have some kind of internet groups, and that can work too. That can provide this sense of belonging that they need.
Right.
And the feedback.
So there's
validation.
Good things about social media.
Yes. I think we have to utilize it, but that as a service of causes rather than spreading toxic or, materials. I think there are a lot of possibilities with social media.
That are good. That's so true.
Yes.
And hopefully this podcast is one way we're doing that.
I think it's a wonderful initiative, by the way. I'm glad you're doing that.
And thanks. And I think, we usually end these podcasts by asking I ask my guest about some general thoughts that they have on creativity and maybe what it means to you, or just, it's free flow, whatever you want to say about creativity. But I was wondering if you could share a few of your thoughts about creativity.
Yes. I love this concept or theme a lot. It's part of my life, but I think it's part of everyone's life. Some people think they're not creative, but it's not true. We all have this innate potential, and I think it's an essential element to our resilience. So when we are confronted with stress, I think we need to access that creativity in us to problem solve, to have clarity, and to also have mindfulness. That will help calm us down. So the creativity is also very rewarding because sometimes we produce something, but we don't have to. I think the process is more important than the outcome. And I would encourage people to find their own media or what they like to do, because again, we all have that, and it could be in humor, it could be in writing, it could be in, sports, gardening, name it. There are various ways to express creativity. And I try to incorporate that in my work. I try to know my patients on that level too and ask them, okay, what do you like to do? What gives you the most, what gives you joy? And I encourage them to expand that aspect of their personality. So that's what I have to say. I have a lot more to say, but I express mine, as we mentioned earlier, by writing. I also like to draw, paint, some mixed media, art at times. Whatever I can find, whatever challenge comes my way, I like to also get out of my comfort zone a little bit. And I think being creative is also about getting out of one's comfort zone to grow.
Yes, the growth. Very good point, I think. Well, thank you so much for being my guest. And I think before we go, let's repeat that phone number for folks, because I think that's really important.
I agree. So it's a 1-800-273-TALK. 8255. So again, 1-800-273-8255. And again, don't hesitate to reach out. There are people to help you, listen to you. And if you know somebody who is under stress or depressed, please, please, please give this person the number or reach out if you have any concerns. Suicide is preventable.
Yes.
And we should, as a society, have a concerted effort to try to address that issue.
Yes, I think it's really important. We want people to find help, and everyone's just too valuable, and life is just too short as it is. It really is a very sad end, and, for the typical suicide it's just too tragic. And I think you're hearing here from two physicians who are very concerned and hope that people will find ways to help lessen depression and sadness and to find answers other than suicide. Well, thanks again.
Yes, thank you.
Appreciate having you.
Yes, thank you. It was a pleasure.
Thank you for listening today. For those in despair, I hope you found a message of hope. Carolyn Giroux and I want those of you who are feeling overwhelmed with life to seek help. It's important for all of us to talk about depression and suicide with the knowledge there is hope and a way out of the pain that does not involve the tragedy of unnecessary death. Speaking up may save lives. Add the hotline number to your phone contacts and share it with others. Show notes from today's episode of A Creative Approach podcast, where you can learn more about Dr. Giroux and some of the topics we discussed, are available on the webpage www.acreativeapproachpodcast.com. Please join our Creative Approach Facebook page and the A Creative Approach Facebook group page too. There we welcome your questions and feedback on the show. Just a reminder to become a subscriber to Creative Approach Podcast on your favorite podcast platform if you've not done so already. The podcast is available on Apple Podcasts, Spotify, the Google Play Store, Stitcher, and others. Please join A Creative Approach Podcast in future conversations, where I hope you will find inspiration to make things, tell your story, and explore a creative approach to life.